Welcome to the fourth and final session of the 6th Annual NMA Professional Development Series at the Congressional Black Caucus Foundation Annual Legislative Conference. The partnership between CBCF and NMA is so important in advancing the mission of both of our organizations, and this program has become an integral part of the conference. This year, over several sessions, we have discussed, collaborated, and hopefully moved the needle in advancing health equity for African Americans. In our final session, we will discuss one of our most precious resources and our future, the health of our children. While the negative impact of the tobacco industry on communities of color is well known, we will use this session to explore emerging policies, clinical challenges, and advocacy opportunities for tobacco prevention for our youth. I am always happy to introduce this dynamic moderator, Dr. Winston Price. Dr. Price is an associate professor of pediatrics at the Philadelphia College of Osteopathic Medicine and chief information and technology officer for the W. Montague Cobb NMA Health Institute. He is the 105th president of the National Medical Association. Dr. Price.
Thank you so much, Dr. Villanueva, and thank you for your service as president of the National Medical Association. Good afternoon, good day, good evening, since we are broadcasting internationally. So wherever you are, my name is Dr. Winston Price. I am a past president of the National Medical Association, and I will serve as moderator for today's program. We're going to be talking about emerging tobacco prevention policies and clinical challenges, particularly as it impacts on youth. I have no disclosures. This session will explore emerging policies and clinical recommendations, and also the advocacy opportunities for tobacco prevention efforts targeted at minority youth who are at risk of tobacco use or who are already users. There will be a focus on some of the electronic nicotine delivery systems. And to set the stage, it's important to know that smoking leads to disease and disability and harms nearly every organ of the body. More than 16 million Americans are living with a disease caused by smoking. And for every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. In fact, smoking is the leading cause of preventable death. Worldwide, tobacco use causes more than 7 million deaths per year. If this pattern of smoking all over the globe doesn't change, more than 8 million people a year will die from diseases related to tobacco by the year 2030. Cigarette smoking is responsible for more than 480,000 deaths per year in the United States, including more than 41,000 deaths resulting from secondhand exposure. And indeed, third-hand exposure, as you will hear in the discussion, is also a risk for our children. This is about 5 deaths annually per day, or 13,000 deaths per day, okay? So if smoking continues at the current rate among our US youth, 5.6 million of today's American youngsters less than 18 years of age are expected to die prematurely from smoking-related illnesses. This represents about 1 in every 13 Americans aged 17 years or younger who are alive today. Smoking is also expensive. It costs billions of dollars per year, with a total economic cost of about $300 billion per year. Secondly, as the e-cigarette epidemic threatens the nation's progress in reducing youth tobacco use, more states continue to shortchange the very programs designed to prevent kids from using tobacco products. The latest government survey showed that 20% of US adults and 23% of high school students still use some form of tobacco, with cigarette smoking rates as high as 4.6% for high school students. In addition, the youth e-cigarette epidemic remains an urgent challenge that must be addressed to prevent yet another generation from becoming addicted to nicotine. The latest data show that youth use of e-cigarettes is still at epidemic levels, with 3.6 million users, including about 1 in 5, 19% of high school students still using some type of e-cigarette. With increasing e-cigarette use, flavored e-cigarettes, and their appeal to youth, we have become a prominent concern with the use of electronic cigarette and tobacco delivery systems. Tobacco reduction and prevention is a pediatric problem. We must address that now, because we know that most adult tobacco users initiate their use during adolescence. Today, we have a dynamic group of experts on the subject of youth tobacco mitigation strategies and experts in the delivery systems related to the electronic systems. And I'm sure you'll be enlightened, informed, and motivated to do more to assist in this health crisis. One of our first presenters is renowned Dr. Philip Gardner. Dr. Gardner is a public health activist, administrator, and evaluator, as well as a researcher. And for the past 25 years, he has worked on studies ranging from hypertension, multiculturalism, AIDS, breast cancer, prostate cancer, diabetes, and in particular, smoking. For the past 20 years, Dr. Gardner has lectured around the country on African-American health disparities generally, and menthol smoking in the Black community in particular. Dr. Gardner recently retired as a senior program officer for the Tobacco-Related Disease Research Program at the University of California Office of the President, a position he has held since 1997. Dr. Gardner is currently co-chair of the African American Tobacco Control Leadership Council, a group of Black professionals dedicated to fighting the scourge of tobacco impacting African American communities, both in California and nationally. I have the distinct pleasure of welcoming Dr. Gardner to give us some of his initial thoughts. Dr. Gardner.
Thank you very much for that introduction, Dr. Price. Let me just say good morning, good afternoon, good evening. And again, thank you for having me. You know, it's a bifurcated situation here as we talk about African Americans and smoking. E-cigarettes are becoming the nicotine addiction for the 21st century. Everything is becoming vaporized, as we like to call it. And as already pointed out, there are over 15,000 flavors available for these products. So we know that they hook kids. But let's talk about Black smokers in particularly. It's interesting that we actually have to look at each group, racial and ethnic groups separately to actually comprehend what's going on in that population. There isn't just one, kids are doing this and adults are doing that. When we look at the Black community, what's being smoked in the Black community? What's being smoked are blunts, flavored little cigars, marijuana, and menthol cigarettes. Sometimes we like to, or sometimes I like to call it the reverse gateway effect. Sometimes what's going on in the Black community is that there's an introduction to blunts and marijuana before they're actually introduced to cigarettes. Usually we heard the other way around, that starting with cigarettes will lead to other drugs. And many times in the Black community, it's other drugs that lead to cigarette smoking. Sometimes we have to keep in mind there's a great leap forward that takes place in the Black community, meaning that as teens, there isn't as much smoking going on, but once African Americans are out of the house, whatever the reason they're out of the house, going to the Army, going to college, going to jail. And unfortunately, that's a large number of them, that smoking rates actually tick up. And we have to keep that in mind as we move forward in terms of this. Indeed, many of us who work on the issue of menthol cigarettes and trying to get it out of the Black community, the main vector of death and disease in our community, we have to keep in mind that there needs to be cessation programs that are culturally appropriate and language specific in moving this fight forward. It's even to the point where the tobacco industry is trying to devise ways to hook kids and young adults by saying that, well, we took the nicotine out of this and the only thing is in there are flavors. And I want to suggest to you that flavors in and of themselves, what we call aldehydes, are an irritant to the mucosa and actually are not good for you. And actually, we know some flavors in these cigarettes are actually even worse than others, like diacetyl or cinnamon maldehyde. So I just want to say that in terms of opening, we need to look at what's going on with the e-cigarette epidemic, but at the same time, we need to look at what specifically is going on in the Black community with our youth and with our young adults. And there's sometimes I like to call it the triangulum, the intersection between tobacco, marijuana, and electronic cigarettes, the latter being the delivery device for those two prior. And then it can be the delivery device for everything else. So e-cigarettes has become kind of the go-to product. You can put marijuana in it, you can put tobacco in it, you can put methamphetamine in it, you can put cocaine in it. It's the 21st century addiction. I'll stop there. We'll take questions later. Thank you very much.
Thanks, Dr. Gardner. I'm thrilled that our next presenter, Ms. Portia Riddick-White, is Vice President for Strategic Partnerships at the Campaign for Tobacco-Free Kids. Portia White leads the Department on Strategic Partnerships. Her major focus is to build, cultivate, and sustain relationships with a broad range of organizations, including with the health community, organizations concerned about youth, youth advocacy, and communities that are disproportionately or otherwise impacted by tobacco use. The Tobacco-Free Kids Department of Strategic Partnership reflects a commitment to expand the role and capability of our partnership work and our vision for engaging a wider range of partners, and they work diligently in that respect. As a leader in strategy, outreach, and political engagement, Ms. Portia has led efforts previously with the National Education Association, working with Majority Leader Harry Reid, the Transit Workers Union, 2016 Democratic National Convention, and AARP, including roles as speaker, writer, organizer, lobbyist, and activist. Cumulatively, big word, Portia has over 20 years of experience in advocacy and grassroots organizing and building. It is a distinct pleasure to have her join our panelists today. Ms. White, give us some of your initial thoughts about this issue.
Thank you, Dr. Price, for that introduction, and I'm so glad to be here today. The Campaign for Tobacco-Free Kids, it's an organization that's been around for 25 years, and we are fighting to save lives from that #1 cause of preventable death, which of course is tobacco use. And our vision is a future free of death and disease that is caused by tobacco. So we see tobacco really not as an equal opportunity killer either. And let me explain that a little bit. Tobacco is marketed to and disproportionately affects certain populations. We know that. We know that communities like the Black community, the low-income community, the Latinx community, LGBTQ community, women, kids, teens, people with behavioral health concerns and issues. Frankly, I'd say the BIPOC population plus anyone that the industry views as perhaps they think as vulnerable And that's who they go after with their products. Marketing, even to the point of placing products in locations that are heavily populated with these groups. They set their prices low in the communities and they advertise high. So since the 50s, the tobacco industry's targeted Black communities and kids with this predatory marketing for menthol cigarettes specifically. They've advertised heavily, as we know, in Black magazines. We all remember some of those magazines if you're as old as I am. And there are more tobacco retailers, more tobacco advertising, and more price discounts for tobacco products in Black neighborhoods specifically. Tobacco companies have sponsored community and music events and associated themselves with popular Black musicians. They even had mobile vans years ago that handed out these free cigarettes and coupons in Black neighborhoods. So they've had this marketing scheme that's been horrifyingly successful. In the 50s, there was less than 10% of Black smokers who smoked menthol cigarettes, but today, 85% of Black smokers smoke menthol cigarettes. Now we know that there is an addition of these new products like the e-cigarettes, things that aren't so new like hookah, who they are really bringing even more forward with our community. And cigars and cigarillos that all are encompassed in this tobacco focus of flavors. What they've done is they've included all of these flavors in tobacco products to make them enticing. And so what we want to do and what we have been doing is really educating the population, the various populations, and building partnerships so that we can help spread the word, and also building advocacy within the communities so that we can move together to fight head on the tobacco industry. Thank you.
Thank you very much, Ms. White. And you know, we're going to jump into some of the questions that have come in from our audience, but I want to ask Dr. Gardner, you know, there are some reports that African-American teens and young adults don't use the vape products as much as other ethnic groups, particularly compared to whites. Why is that the case?
That's an excellent question. I think broadly speaking, it may be a situation, and I'm just going to say this from past experience, it may be a situation like we saw with the skateboard. 40 years ago, 45 years ago, when skateboards became popular in the mid 70s and early 80s, there were white kids were doing skateboards and everybody was, all of a sudden, a number of kids began to do skateboards. Today, everybody does skateboards. So I think there's a question of culturally catching up. And as I said in my opening remarks, I think there's a particular, Blacks are smoking, have different smoking profile. There's a lot of marijuana being smoked in our community. There's a lot of blunts being smoked in our community. There's a lot of little cigarettes, cigarillos being smoked in our community. That's kind of what's going on. I guess not to put too sharp of a point on it, but why the e-cigarette thing has become such a great discussion is because it affected so many white people. There was outrage 2 years ago when, you know, some kids began to do this, and then thousands of kids began to do it, and literally millions of kids had begun to do that. The majority of them were white. And they actually held hearings on it and began to pass rules around it. We've been trying to deal with menthol for the last 20 years or so, and they haven't, frankly, done a damn thing about it. So we have to keep in mind why e-cigarettes have become such a big issue is because it affected the majority population in this country. And at the same time, we need to focus on the most vulnerable, particularly within the African-American community, and look at what they're actually smoking. If they're not smoking e-cigarettes right now, we need to get them off them. The idea, and then this is another discussion comes up, Dr. Price, is that, well, maybe e-cigarettes are safer and could be an off-ramp for regular cigarettes. Well, the cold facts is that the difference between jumping off a 12-story building and you're only moving down to the 6th floor and jumping off, you're still hurting yourself tremendously, and then many times destroying your health in the future to come. So I think because there's already a certain smoking profile in the Black community, where e-cigarettes only now are becoming a part of that, and will I would argue, will increasingly become a part of it as the tobacco industry pivots to make sure that more of it comes into our community.
And there are some pundits who would say that, you know, this e-cigarette fad is just a passing hobby of youth, and that if we just sit back, it'll disappear. The American Academy of Pediatrics, the AMA, and the American Association of Family Physicians took a strong stance in denouncing this wave of e-cigarettes as a major problem. You know, it's something that seems to be of an import. Ms. White, what is the campaign for tobacco-free kids, and what are you doing to combat some of the pervasive marketing that big tobacco is doing and aiming at our kids?
So we're focusing on this whole flavor piece of all tobacco products, like the menthol cigarettes, which, you know, there was an opportunity years ago in 2009, as Dr. Phil has said, to take it off the market, but they didn't do that. You know, they took clove cigarettes off, but they didn't take menthol. And so we're focusing on e-cigarettes, actually, also that they come in all kinds of flavors. You know, flavors that kids like cotton candy, mint, bubble gum, sour apple, and yes, menthol as well. And these flavors hook our kids with no matter what product that they're using. And we know that, like I said earlier, that they use these same flavors in other products like the hookah, the cigar, the cigarillo. And frankly, African-American youth, Black youth are really high cigarillo users, believe that or not. And so we know that menthol is a starter flavor. Everyone knows how menthol numbs the throat and masks that harshness of cigarette smoking. Of course, it makes it easier to try, easier for kids to try cigarettes and eventually get hooked on tobacco products. And so menthol, as we know, also makes cigarettes more addictive and products addictive and harder to quit. So the bottom line is that more young people start smoking and fewer smokers quit. And that's especially the case among Black Americans who've been targeted by the tobacco industry. So what we're doing, we're actually reaching out and elevating, moving forward policies that are in the municipal, the local, and federal level to help curb the use and save lives in all communities. But we are very much focused on the inclusiveness of making sure that all of the Black lives that have been affected, that continue to have the morbidity and diseases that are a result of tobacco use, we're working to help change that dialogue and to move that so that we are saving lives.
So nicotine is the hook. So if nicotine is the addictive component in combustible cigarettes and in the e-cigarettes, Dr. Gardner, if we remove the nicotine from these products, is it still bad for them to use?
Yeah, I kind of mentioned that in my opening, and I think this is actually very important. It has been used, the industry, both the hookah industry and the big tobacco industry are producing products that quote unquote just have flavors in them and don't have nicotine in them. While sometimes that is not true, there's been studies that show that what's labeled on the package isn't necessarily true. But in the cases where there isn't nicotine in it, we are still dealing with, and I mentioned this, the question of flavors. And flavors are by definition an aldehyde. And as I mentioned, aldehydes are irritants of the mucosa. You might look at it this way: what's safe for one to ingest is not necessarily safe for one to inhale. And I think that's the take-home message with these products. Unfortunately, I mentioned diacetyl before. It's an additive that is put in to electronic cigarettes, particularly in sweetened products. We know that number of workers were seriously injured in Missouri 6 or 7 years ago, I guess now, maybe, yeah, in 2016, when they were exposed. Diacetyl is also used in making popcorn, microwave popcorn. And what it does, and once it gets into your lungs, it gets all the way down and blocks the alveoli and allows for, not the exchange of oxygen that is necessary. One person, I think all 4 of the people had to quit working at that plant. So we have studies that show that diacetyl unfortunately exists in nearly 75% of the products that are sold. Now, let me just bring in a social justice issue here. Many manufacturers understand what I just said, and many have removed the diacetyl, but these are high-end places, high-end stores. And what Black folks run into on the street, if they're running into e-cigarettes, those cigarettes that are cheaper still have the diacetyl in them. So let's just keep in mind that there's a social justice issue that is going on here too. So yeah, flavors hook kids. Flavors can actually damage kids, period. And let me just emphasize that most people that are using e-cigarettes, knock on wood, are dual users, meaning they're using e-cigarettes and some other form of tobacco products. There's a great study done a few years ago looking at the different racial and ethnic groups and what they were smoking. And we found with African Americans that 50% of them were using little, Portia mentioned this too, were using little cigars and cigarillos along with their cigarettes. We found in the Native American community that along with e-cigarettes and and regular cigarettes, there's chewing tobacco. So we have to look at each of these communities in their specificity when we deal with this question. And yes, flavors hook kids.
So Dr. Gardner, if you were to put e-cigarettes and combustible cigarettes on a scale, on a balanced scale in terms of the toxins that are in it, would you say that both of them are equally toxic to the lungs in children?
I think that's a good question. We know that it is bad for your lungs to inhale aerosolized nicotine and aerosolized other components. Look, there are many different, there's acetaldehyde, there's formaldehyde, there's all these other ingredients that are in the electronic cigarette that we find in regular cigarettes. Sometimes not at the same amount, but often the same actual chemicals. We find nicotine-specific nitrosamines in electronic cigarettes, the same nitrosamines, the same cancer-causing agents that are found in regular cigarettes. I made the analogy before, I might just change it a little. Cigarettes is like jumping off a 12-story building. E-cigarettes is like jumping off an 8-story building. You're going to still seriously damage yourself. And not to belabor the point, and we don't have any visuals here, the tank systems, the things that you can fill up yourself, you can put different concentrations of nicotine in it with different amounts of flavoring in it, and you can dial up the voltage. Usually cigarettes are at voltage at 3.2 volts. But if you dial it up to 3.8 or to 4.0, you increase the actual cancer-causing propylene glycol becomes much more damaging when you turn up the propylene aldehyde. It becomes much more damaging when you turn up the heat. So people that are using tank systems actually putting themselves at greater risk for this in the first place.
Great, great, thank you. So, Ms. White, how can medical providers and legislators and regulators use their voice and standing to bring attention to the youth e-cigarette epidemic and urge their co-legislators and their community activists and decision makers to take action? What can they do?
Well, first of all, they need to do just like we're doing today. Really learn the facts, understand the facts, and get educated on the issue. There is a survey that's done yearly, the National Youth Tobacco Survey. And that survey, the information that we got back from that from 2020 says nearly 3 million youth use flavored e-cigarettes, including over 1 million, that's like 37%, who use menthol flavored e-cigarettes. That's phenomenal. That's an epidemic, right? And 70.3% of the current youth, ages like 12 to 17 e-cigarette users say they use e-cigarettes because they come in flavors that they like. So we're hitting it on the head when we say directly that it's these flavors that are the addictive piece of this. So, medical providers have a unique perspective. You can be really powerful in demonstrating the urgency of this youth flavored tobacco crisis, and simple advocacy actions that can make your voice heard on the whole scale of being influencers to policymakers. That's at the municipal level, the local level, the federal level, and we recommend contacting your state and local and federal elected officials and urge them to take steps to help protect kids, help protect our neighborhood, help protect our community from this tobacco force that's been kind of just prevalent among us from the tobacco industry. So many cities, localities, and states are currently considering these prohibitions on flavored e-cigarettes. So call the officials, tweet at them, attend town hall events, tell your elected official why you're concerned. And as a healthcare provider, that, the impact of e-cigarettes and flavored tobacco, just as Dr. Phil has just, stated, it's a killer. So do your best to get involved and to share the news, share your knowledge. That's what you can do.
Can I share something?
Yeah. Yes. Go ahead.
No, I think that's not only right what Portia's saying. Let me just not put too sharp of a point on it. The FDA just recently said they were going to begin the rulemaking process around menthol. They're not even going to produce the rule for the next year. After that, there'll be months and months of back and forth by the industry submitting, and I do not exaggerate, hundreds of thousands of comments to try and move the process along. They will ask for delays. And even after the final rule is proclamated 2 or 3 years from now, they will probably sue. So back to Portia's point, we have to continue this fight at the local and state level. I mean, we're fighting at the national level. My group, the African American Tobacco Control Leadership Council, has sued the FDA along with our co-plaintiffs, Action on Smoking and Health, the American Medical Association, and the National Medical Association. We've sued the FDA, but that's the only reason they're doing something, but it's going to take them years. So I just want to underscore that we have to keep this fight up at the local level. Please, please, please.
And there's a ton of money that came about as a result of the expose of the tobacco industry and the harmful products that they were pushing on the American people. That money was to be used for prevention programs, for smoking cessation, for education. Where is all that money, Ms. White, and is it being used effectively?
So there is an organization, at least that I know, that really works toward that good and educating the community. Some of that money, and the state's got some of that money as well to help educate on their level, the community. Education is one thing, right? But it's that next step that we have to take that we have not come together adequately on, as Dr. Phil has really just mentioned, which is this whole, the whole piece on what's going on with the FDA. That's there, but we have to do our work in another fashion by really digging in locally. So it's going to take a village, so to speak, to continue this effort, not just the education piece, but the advocacy arm of really putting a light on the fact that this has happened, what is happening with the cessation efforts. I will say federally, there is a bill that has been introduced that will be helpful with the cessation force from one of our CBC members. So that's great. And we need to push that bill. It's the Quit Because of COVID Act. We need to push that bill, but we need to do more than that. We need to make sure to hold accountable these state and local efforts to help with the cessation products and things on the market and help people get the help that they need. Indeed, Dr. Phil is right. Once this FDA regulation gets to a point of a notice of proposed rulemaking, and you have your 60 days to make comments, and after the comment period, things can happen right or left. And frankly, he's right. The industry is going to fight this tooth and nail, I'm suppose, and you'll see lawsuits. But in the meantime, we have to do what we can to be forward with the cessation efforts. And I really believe that that is a great part of where our thoughts need to go. So thanks for asking that and bringing that up.
Great. And our legislators are providing the oversight to the states, making sure that a significant amount of the money is reaching our BIPOC communities to initiate some of these prevention and intervention strategies, or is it
I think it's probably just the opposite, unfortunately. I think the initial push, the Master Settlement Agreement, which was agreed to in 1998, gave, at least in California, $206 billion to the state toward tobacco control. Not a penny, well, that's not saying it too strong. The majority of that money did not go to tobacco control. We had passed our own bill, Prop 99, and back in 1998. And that's why we had strong program. And we passed another bill in 2016, Proposition 56, which actually not only increased tobacco money, but actually put a health equity clause in there that money needs to go to those groups that need it the most. That actually helps set up what we call the statewide networks of priority populations here in California. But specifically to your point, Dr. Price, unfortunately, the majority of money that came out of the Master Settlement Agreement that went to states did not go to tobacco control, whether it's cessation, advocacy, or the horse we rode in on. And that's why we even have to keep having these fights over and over and over. The tobacco, look at it this way: the further up the food chain you go, the more power and influence the tobacco industry has. That's why it's so important to fight at the local level, where we can actually get people that live in a community together to say they want to protect themselves. Because once you get to the state level, there's going to be back and forth. I mean, there's even move now to try and repeal Massachusetts bill that outlawed banned menthol. Similarly, in California, the tobacco industry spent somewhere in the neighborhood of $21 million to get what was passed by the elected officials and signed by the governor to stop that bill and put it on a special election. They collected over 600,000 signatures. They were giving money away to sign the thing. These are not to be trusted folks. We have to continue the fight on all these different levels, but be appraised. Then yeah, the further up the chain you get up to. I'm going to use this as one last example. In 2016, the FDA put forward that that they should remove all flavors, including menthol, from all these new products: e-cigarettes, hookah, little cigars, all of that. Remember, 2009 was just about cigarettes. It wasn't about these other products, but they had the ability to deem them in. In 2016, they wanted to deem them in. And when they deemed them in, they said they shouldn't have any flavored products at all. That was sent to the Office on Management and Budget, and people who had worked in the tobacco industry in the Office on Management and Budget literally redlined the 16 pages of appendix on flavors. That's during the Obama administration. The tobacco industry has lawyers throughout. I don't want to overstate this, but they're the further up the food chain you go, they're there. And until we can actually get some more people, get some better Congress people, we can actually do something. I mean, the Pallone bill in HR. Yeah, I'm not going to get that right. The Pallone bill, which was passed in February of 2020, actually called for the removal of menthol cigarettes. House passed it, sat on the floor of Mitch McConnell's office for the last 2 or 3 years. Now that there's a new administration, we have to figure out something else. That's how powerful these folks are.
Can I add something?
Absolutely.
You asked a question specifically about, yes, the master settlement agreement and the money that the tobacco industry had to pay into that so that the states would be able to rectify some of their wrongs, for the lack of a better term. So the MSA, or it imposed restrictions on the sale of marketing cigarettes, really, right? And participating cigarette manufacturers. And among all these provisions, the one thing that I think that the states have not done the best deal with, agree upon by Dr. Phil, is the fact that how much money they've actually spent on tobacco prevention and cessation programs. They really haven't spent enough money there. That money has gone to the states, and that's where we need, as a people, as advocates, to stand up and really dig in and find out, well, where did that money go, and what did you do with that money, and what are you putting it toward? So we need to be a bit more watchful, right? And we need to be more involved in figuring out where this money was spent. Some of it was supposed to be spent on programs to prevent kids from smoking and to help smokers quit. But I'm not so sure that they've done the best job there. So I agree, we do need to be much more watchful with where that money is spent and hold people accountable.
Absolutely. And there are some data that suggests that the tobacco industry is spending 5 to 8 times as much money as it should be available for prevention programs on marketing to youth and to young smokers. So it's an uphill battle, and it's something that I think our legislators need to be aware of. And I think as providers in health education need to be aware of in educating their patients. I'm proud to say that the National Medical Association has been in the forefront of advocating for these smoking cessation programs and prevention programs. And in fact, these educational series that we're doing are to the forefront of getting more of our providers in our communities to be aware. In that light, one of the important aspects is research. And so the NMA has been advocating for access to some of the settlement money to engage in more research on the effects of combustible tobacco, nicotine, the menthol flavors, and the e-cigarettes in our population. Now, that's not to say that we have doubt about the impact, but I think if you're going to be talking about intervention strategies and mitigation strategies and harm reduction, then we should be doing some of the research on our own patient population and coming up with our same facts. In that light, Dr. Gardner, we know nicotine is harmful to the developing brain. Why do some doctors think that e-cigarettes can be used for youth cessation?
I think that's a great question. We had this discussion, I guess, a month ago, where some doctors were putting out that, quote unquote, it can be an off-ramp from regular cigarettes to serve as an off-ramp for people using regular cigarettes to go to e-cigarettes. The problem is it's an on-ramp for kids. That's where they start, is with the e-cigarettes, and then they move on to these other cigarettes. So I'm, frankly, I don't know why a doctor would put something out like that. I really don't understand that. I don't even know. I'm not even sure how to respond to that. There's a belief that e-cigarettes are less harmful for you. In some respects, that may be true. When you look at it overall, they're not good for you, and they shouldn't be used in that capacity or in that way.
And we heard some very enlightening efforts by one of the pharmaceutical chains and one of the major insurers in getting to the smoking cessation by taking the bold step of removing tobacco products from their retail stores. I think this is phenomenal because I've always contended, even 20 years back during my presidency, that you can't have a pharmaceutical chain selling tobacco products in the front of their retail stores when they're making profits of those same patients having to go to the rear of their store to get medications for cardiovascular disease, for cancer treatment, for congestive heart failure. And so, there is one company that at least is stepping to the fore in eliminating tobacco products from their stores. Should there be legislation or regulation to force the other pharmaceutical retail chains to do in like kind?
This is gonna be a little hard for you to take. So I agree. I think, I've worked on a number of local campaigns where we want to get selling tobacco products out of pharmacies. I think it's a contradiction in terms, frankly. The point's well taken. Having said that, CVS still has tobacco industry stocks that they have, and they are part of the retirement package of their employees. So they didn't make a complete break. Yes, I'm glad they got them out of the stores. That was a good thing. In fact, their sales have increased, their image and their sales have increased. But to stop buying tobacco stocks, I think is going to have to. And I want to say this, Winston. I didn't raise this when the CVS folks were on the panel that we did a few weeks ago, because it is very. While some people think it's controversial, I don't think it's controversial at all. I think you got to stop buying tobacco stocks. There's a period there. So I think we have a long way to go in terms of that. I think it's actually, I'm knocking on wood here, I actually think it's getting a little easier to get pharmacies, or at least local areas, to prohibit the sale of tobacco products in pharmacies. Because it's becoming very clear that these things are, you can't, you go to the back to get your medication for your heart disease, and you go to the front to get the heart disease. I think we're approaching something on that. But so CVS has a long way to go too. We all do.
I hear you. Ms. White, as an advocacy organization, what resources does Tobacco Free Kids offer or promote to help prevent youth tobacco and e-cigarette use?
So we actually have a, we're very much involved in assisting the youth and those who really want to learn more. We have an advocacy training program called the Takedown Tobacco, where adult allies as well as youth themselves can go and they get accurate evidence-based information about tobacco and e-cigarettes. We've got this e-cigarettes specific course as well called The Rise of Vaping that explains how Juul started the e-cigarette crisis. It gives stories of addiction and quitting from real youth, and it gives youth concrete ways to help refuse e-cigarettes. The Takedown program is completely free, and it can be used individually or in classrooms, and you could actually check it out at going to takingdowntobacco.org. That's takingdowntobacco.org. We continue to work together in building relationships and partnerships within various communities. And within those communities, whether that's the faith community, whether that's the HBCU community, we are working toward placing resources in the hands of, of even congregants from this faith view, and making sure that they understand from a faith perspective what's at risk and how to help curb the use of tobacco products within their congregations, or whether that's, with the adults, and to help the youth who are there to not start. So we've got various resources working with various groups that we are putting out. And I just, I welcome everybody to go to our website, tfk.org, campaignfortobacco.org, and find out more, or just email me at pwhite@tobaccofreekids.org.
Great. And so one of the things that's always been helpful to me, and we're all in the area of analytics, and those of you who are following the Olympics knows that analytics is an important part. So scorecards. What can either of you help our audience with regard to scorecards of states and some of our legislators in terms of who's doing a good job, who's not doing a good job, and where the battlegrounds are going to be the hardest?
I forget who puts it out, but I think, a report card or a scorecard comes out every year. It's either from lung cancer or heart. I would go to their websites and look at that. They usually do that. I would encourage people who are listening to do that. Unfortunately, there's a lot of people not doing a lot of good work. So, and at the same time, there are some places that are doing actually very well. So, like Massachusetts and California. So, it's either American Heart, American Lung, or American Cancer Society that would have that information for you.
Actually,
also,
that is actually, you can go to www.lung.org. They actually have the State of Tobacco Control, a report that evaluates states and the federal government on the proven effective tobacco control laws and policies necessary to save lives. So they have
lung.
that.
Okay.
It's lung. Mm-hmm.
Let me just go another place. Americans for Non-Smokers' Rights. If you go to Americans Non-Smokers' Rights website, they do a report card on indoor air quality and laws. So that's another resource and place to go for people.
Great. And does that also include how some of our elected officials are voting on some of these issues?
I don't think they do individuals. I think they'll do states and then states and some even do some counties, and then you can deduce from that the individual politician as it is. There used to be
Yeah,
a thing in California, I'm sorry, the American Lung Association doesn't do it anymore, that would put out a quarterly report of who's receiving money from the tobacco industry. And we were able to track for years how money was being spent in Sacramento to try and influence legislation. Even though there's something similar to that being done by the American Cancer Society Action Network, it's not as robust, I would say, as the one that the American Lung Association had done in the past.
yeah, I would just say that the information that is provided on the lung.org website really focuses selectively on states, various states. They give information on the laws that have been passed regarding tobacco prevention and cessation funding. So that's good. Access to cessation services, smoke-free air, flavored tobacco products. And they highlight this information per state, the laws, the policies, the state rankings, the findings, and they give a federal grade on it. So it is a helpful tool as far as where to go to get more support specifically for your state. And that's part of that watchdog piece that I mentioned early, as far as making sure that you are being watchful in what's happened with the money that has been given to the state from the master settlement agreement. See where it flowed and see how it's flowing now.
Well, that's great. Now, just a little bit out of the box in terms of the global market, because we recognize that the flow of cigarettes, both e-cigarettes and combustibles outside of the US, portends how much money these tobacco companies are making. And because the revenue stream from tobacco production, as well as from the taxes that come in, not just for the towns and the countries, but also the workers. There are several international countries that do not want tobacco cessation efforts at all. How does that factor into what we're doing here within the US?
So, we have a global division at the Campaign for Tobacco-Free Kids that focuses on what is going on globally within the tobacco industry. We continue to keep an eye on PMI, Atira, all of these tobacco companies and what they're saying globally and what they're saying domestically. They tend to mix their words. Let's just say that. They tend to mix their words, whereas I guess even the global market recently highlighted the fact that they were going to rid of cigarettes, and I guess they're going to just then focus on the e-cigs. So, there's this conglomeration of efforts from the industry and what they're doing in each country. And as we know, Juul has been pushed back and forth in those efforts too, with their products. Some countries have accepted, some countries have said no, now denied. And so there's a bunch of, a lot of movement. And frankly, that dial continues to move, and how it affects us here domestically with where we then move forward with our efforts, it's also affected. So it's hard to answer that specifically from my point of view right now, knowing that the dials continue to move.
I would just add that I'd flip it on its head and say that we know as of now that Brazil, Canada, Ethiopia, Turkey, Moldova, the European Union, and the United Kingdom have all banned the sale of menthol cigarettes. And so there is some motion, both on the African continent and South America, in the European Union, and hopefully now here, and of course Canada, and then hopefully here in other parts of North America. So I want to, while I think there's been resistance, at the same time there's been a large step forward as it relates to this. So I just want to put the other side of put the other shoe on, as it were.
Well, I appreciate that, and certainly we understand that we're at crisis level. Both of you have enlightened us with a wealth of information with regard to where things stand now with regard to tobacco and e-cigarette use in our youth. Again, 3.6 million users, and having 19% of high school students using tobacco products is a major problem. Last thoughts, Ms. White.
My last thoughts are that you can make a difference. And your difference being a practitioner in the healthcare, the medical system, means more than you probably can even imagine. We recently did a focus group study, and in that focus group study, what came back to us specifically from the African American, the Black community, is that the number one trusted, influential voice in the community is that of the doctor. So I would say, please get involved, and please understand and share with your patients the necessary steps that they need to take to be free of tobacco.
Great. And Dr. Gardner, last thoughts, and also include in that how we clone you so that the other states can do as well as California.
Well, thank you. Claim no easy victories, tell no lies. I would just leave you with what I call a framework for our time. Menthol cigarettes and flavored little cigars are the main vectors of death and disease into the Black community and other marginalized communities in the United States. With the COVID-19 pandemic resurging as it is now, it has just shown for everyone to see the disparities that exist in our country, that have existed for hundreds of years. If we want to do anything to save Black lives and to show that Black lives matter, then the step we can take is to get these flavored tobacco products, menthol, and flavored little cigars and flavored e-cigarettes straight out of the Black community. And that's the words I'd leave you.
Well, thank you very much. Again, I want to thank Ms. Portia White and Dr. Gardner for your enlightening and very informative information with regard to tobacco youth exposure and the risk to their developing brains. This session on the emerging tobacco prevention policies that we have here in the United States, and some of the clinical challenges and the implications have been very, very timely. We know that we're going into the flu season. We know that we're continuing to struggle with the elements of the pandemic and some of the long-term effects. And so eradicating another challenge to the health and well-being of our population is not something that we can afford at this point in time. This session, we explored some of those emerging policies and clinical implications. And I want to personally thank you each for your involvement and time in bringing this important information to the fore. I want to thank the National Medical Association, obviously, for their forthright attention to addressing this crisis in the disparity in health for our people. And with that, Thank you all for your attendance, and we look forward to seeing you again at one of our sessions. Good day.